Welcome. Welcome to the deep dive. You know, when we talk about healthcare, our minds usually jump straight to the big stuff, right? Amazing surgeries, new drugs, diagnostics.
Yeah, the clinical breakthroughs.
Exactly. But behind all that, there's this massive kind of invisible engine running things, the administrative side, and especially medical billing.
Uh-huh. And for patients, it's often just confusing, stressful even, unexpected bills showing up.
Totally. And for the providers, it's a huge drain. Time, money, resources, all tied up in paperwork.
It really is the unsung part of healthcare, or maybe sometimes the hidden burden, you could say. And that's exactly what's changing radically. It needs to.
Which is why we're doing this deep dive today. We're looking at how automation, AI, digital tools, how they're transforming healthcare, but with a real focus, a laser focus on medical billing.
Because it's ground zero for so many pressures right now.
Right. You got rising admin costs, constantly changing regulations, staffing shortages. I mean, it feels like automation isn't just a nice to have anymore. It's becoming absolutely vital.
It's a necessity, no question. So our mission today, we want to pull out the key insights, the real nuggets of knowledge, from an expert analysis looking at where billing automation is headed.
Basically, give you, the listener, a shortcut. Help you understand what's happening now, what cool stuff is coming down the line, the actual benefits, and yeah, let's be real, the challenges too.
Exactly. It's a critical piece of healthcare finance that honestly doesn't get talked about enough.
So settle in. We're drawing from a pretty comprehensive look at how automation is set to reshape, well, pretty much everything about medical billing. This impacts everyone, small clinics, big hospitals, you name it. Okay, so we often talk about, the shiny new tech in medicine, but this billing bottleneck, it's been there a long time, and it feels like it's just screaming for an overhaul. Why now? Why is automation suddenly an absolute requirement, not just a nice idea?
It really is hitting a critical point. And the source material we looked at points to three main drivers, three big reasons why it's so urgent now. The first one, and maybe the one hitting hardest financially, is those rising administrative costs.
Right. The sheer expense of it all.
Yeah, think about the burden of doing all this manually. Every claim, every payment posted, every denial that needs chasing, it takes people, lots of repetitive tasks.
Which means mistakes happen.
Exactly. It's just human nature with that kind of volume.
Yeah.
And every single mistake, that needs more manual work. Someone has to find it, figure it out, fix it. It just compounds.
So it's not just paying salaries, it's paying for the inefficiency on top of the salaries.
Precisely. It's like this constant drag on the system. The cost of not automating, the cost of sticking with the old manual way is probably starting to outweigh the cost of actually putting in these new systems. We're not just tweaking things. We're trying to eliminate that fundamental drag. Let people focus on the tricky stuff, not just data entry.
Makes sense. Okay, what's the second big pressure point?
That brings us to regulatory pressures. This is a huge one. The rules in healthcare billing, they're not just complicated, they're changing all the time.
Ugh, yeah. IPA, payer rules.
Exactly. You've got incredibly detailed rules for coding, for billing procedures, privacy laws like HIPAA here in the US, GDPR elsewhere, and then hundreds of different insurance companies, each with their own specific requirements and updates.
It sounds like trying to play darts blindfolded while someone keeps moving the board.
That's a pretty good analogy, actually. Keeping up manually is it's a monumental task. And the stakes are high. Make a mistake, you could be looking at big fines, painful audits, even legal trouble. It's a constant risk.
So automation helps how? By just knowing the rules.
Essentially, yes. It offers a consistent rule-based approach. You update the software with the new regulation, and boom, it's applied instantly across the board. It takes away that human burden of remembering every little change and dramatically cuts the risk of non-compliance.
Okay, that's a huge operational relief, I bet. And then you mentioned staffing. That's the third piece.
You got it. The third critical factor is staffing shortages. Finding and keeping skilled admin staff, especially in specialized areas like medical coding and billing, it's tough right now.
These aren't just basic admin jobs, are they?
Not at all. They require specialized knowledge, certifications often. You need to understand medical terms, complex procedures, thousands of codes, payer rules. The talent pool isn't huge, competition is fierce, and training new people takes a lot of time and money.
So the existing teams get stretched thin.
Exactly. That leads to burnout, more mistakes because people are rushed, and the whole revenue cycle slows down. It's a real bottleneck caused by not having enough skilled people.
So, okay, rising costs, complex rules, not enough staff. For a hospital or a clinic, how does this actually play out? How does it hurt patient care or their bottom line? It sounds like a vicious cycle.
It absolutely is a vicious cycle. When admin costs are ballooning and your staff are drowning in paperwork and trying to keep up with rules, the impact spreads everywhere.
Patient care suffers.
It can, definitely. Resources money. People's time gets sucked into the back office instead of being used for patient services, new equipment, or just improving the patient experience. And think about the patient's view. Confusing bills, unexpected denials, struggling to figure out what they owe. It causes real stress.
Yeah, nobody enjoys getting those incomprehensible medical bills. It definitely erodes trust.
It really does. And for the providers, it means payments get delayed, they end up with more bad debt. It's just this constant fight to stay financially healthy in a system that feels designed to be difficult.
So the old way, the manual, reactive way, it's just not working anymore.
It's unsustainable. Automation is really seen as the key to flip that script, to move from being reactive and error-prone to being proactive, efficient, and financially stable. And ultimately, that supports better patient care. It doesn't take away from it.
It's easy to think of automation as, robots in the future or something. But like you said, a lot's already happening. It's not just theoretical. So what tech is actually out there now making a difference in medical billing today?
You're absolutely right. The future is kind of already here in pieces. A really common one you see making waves right now is RPA, Robotic Process Automation.
Not physical robots though, right? Software bot.
Exactly, software bots. Think of them as digital workers trained to mimic human actions on a computer, clicking, typing, navigating systems. They're fantastic for those really repetitive, rule-based tasks.
Okay, like what specifically in billing?
Claim submission is a prime example. Instead of a person manually pulling data from the health record, typing it into claim forms, logging into different insurance portals, sending it off, an RPA bot can do all that.
Automatically?
Yep. Logs in securely, grabs the data, fills the form accurately, submits it, all in seconds. Imagine a big hospital submitting thousands of claims a day. The efficiency gain is massive.
Wow, okay. And payment posting when the money comes back.
Same idea. When those electronic remittance advice files, the ERAs, come back from payers saying what they paid or denied, RPA can automatically match those payments to the right invoices, post the credits, even flag problems like underpayments. It takes a huge load off staff doing that tedious matching work, reduces errors too.
Okay, so RPA handles this straightforward, repetitive stuff. But billing's not always straightforward, right?
Yeah.
What about tasks needing more intelligence, like predicting problems?
That's where AI and machine learning, AML, step in. They go beyond just following rules. They learn from data, spot patterns, and make predictions.
Okay, give me an example. How does that help with claims?
A big one is predicting claim denials. AI can look at millions of past claims codes used, patient history, payer denial patterns, and flag a new claim that looks likely to be denied before it even goes out.
So you can fix it first.
Exactly. Human staff can jump in, correct the issue, maybe add documentation, and dramatically increase the chance it gets paid the first time. That saves so much rework later. AI is also getting really good at fraud detection, spotting weird billing patterns that might signal abuse. And it can even suggest medical codes based on what the doctor wrote in the notes.
So it's not just faster, it's smarter, helping avoid problems proactively. That's a big shift. But, there's still so much paper in healthcare, isn't there? How does automation deal with, scanned documents or faxes?
Yeah, that paper problem is real, especially with older systems or smaller practices. That's where OCR, Optical Character Recognition, is crucial. It's the tech that lets computers read text from images, like scans or PDFs.
So turning a picture of words into actual text data.
Precisely. A classic example is reading paper explanation of benefits, EOBs. Some payers still send these instead of electronic files. OCR can scan the EOB, pull out the patient name, service date, amount paid, denial codes, all that key info.
And feed it into the system automatically instead of someone typing it all in.
Exactly. It bridges that paper to digital gap, which is still essential in many workflows.
Okay, so OCR gets the text. But what about understanding the meaning in all those detailed doctor's notes? They're not usually structured like neat forms.
Yeah.
They're narrative, right?
Right. And that's the job of NLP, natural language processing. NLP is about understanding human language, the meaning, the context, the relationships between words.
How does that apply to billing?
Think about those clinical notes, full of medical jargon, abbreviations, descriptions of symptoms and procedures. NLP can process that unstructured text, identify the key diagnoses, the procedures performed, and help ensure the medical coding is accurate and complete. It can find the phrases that justify specific codes.
So it helps translate the doctor's story into the right billing codes.
Essentially, yes, which is critical for getting paid correctly for the services actually provided. It makes coding much more efficient and potentially more accurate.
That sounds like a huge help for coders. Okay, one more area, the patient side. How is tech making that interaction less painful right now?
That's where chatbots come in. We're seeing more and more AI-powered chatbots helping patients with common billing questions.
Like on the hospital website.
Yeah, exactly. A patient can ask, "What's my balance?" or "Can I get my last statement?" And the chatbot can often pull that info securely or guide them to the right place. They handle basic queries, explain terms, outline payment options.
Which frees up the human staff, I imagine.
Definitely. It offers patients instant answers 24/7 and cuts down the call volume for the billing office, letting them handle the really complex or sensitive patient situations that need a human touch.
Okay, so we've got RPA for repetition, AML for smarts, OCR for paper, NLP for understanding text, and chatbots for patient queries. That's quite a toolkit already in play.
It really is. And what's interesting, as the source material points out, is that often these tools are working, but maybe in their own little silos. RPA does this, AI does that.
Right, not always connected.
Sometimes not seamlessly, no. The real power, the next level, comes when these technologies are integrated, when they talk to each other, share data intelligently across the whole billing process. That's what sets the stage for the much deeper automation we're starting to see emerge. This current landscape, it's just the foundation.
We've talked about what's happening now, but okay, let's look ahead. If we fast forward a bit, what's the next wave look like? Where are the really big leaps coming in medical billing automation? This is where it gets really exciting, right?
Absolutely. The future is about taking these existing capabilities and pushing them much, much further towards real autonomy and intelligence. And one of the biggest areas set for disruption is coding automation.
So moving beyond AI just suggesting codes, talking about AI actually assigning them, maybe with minimal human review, that seems like a massive jump.
It is a massive jump, but the technology is getting there. We're talking AI that doesn't just scan keywords, but truly understands the clinical context from EHR data, doctor's notes, lab results, everything.
And it can handle the complex codes like CPT, ICD-10.
Exactly. Suggesting and potentially auto-assigning those complex codes, CPT for procedures, ICD-10 for diagnoses, HCPCS for supplies. These codes are incredibly specific, they change often, and getting them slightly wrong means a denial. AI's ability to process vast amounts of information and apply rules consistently means it can achieve a level of accuracy and speed that's hard for humans to match consistently.
The impact there would be huge. Less reliance on manual coders, fewer errors, faster billing.
Precisely. It tackles a major bottleneck in the current revenue cycle head-on.
Okay, that's coding. What about the claims themselves, getting them out the door clean the first time?
That falls under advanced claims management. And this is where AI really shines in being proactive. Before a claim even gets submitted, imagine automated checks for completeness as everything filled out. Our attachments there. Then, really smart claim scrubbing.
Scrubbing meaning checking for errors.
Yes, but way beyond basic checks. AI applies complex, payer-specific rules, national guidelines, even learns from past denial patterns for that specific payer to catch errors before submission, things a human might easily miss.
And you mentioned predictive routing. What's that?
This is really cool. Based on history, the AI predicts the chance of a specific claim being denied by a specific payer. If it flags a claim as high risk, maybe it's a complex case, unusual combination of codes, it automatically routes it to a human expert for review before it goes out.
So you catch the likely problems up front.
Exactly. It drastically cuts down those initial rejections, streamlines submission, gets clean claims out faster, which means less rework and faster payment.
Okay, clean claims out faster. Huge for cash flow. What about when the payment does come back? Full automation there too.
That's the goal. Payment posting is another area heading towards near-complete automation. The fully automated ERA and EOB posting.
There's no more people matching line items.
Largely, no. The system automatically matches payments to services. Crucially, it instantly flags any underpayments or denials. No more tedious manual reconciliation that takes hours or days.
The impact.
Much faster cash flow for the provider. And real-time visibility. They know exactly what's paid, what's outstanding right now. It enables much quicker financial decision-making.
Okay, but even with perfect scrubbing, some claims will still get denied. It happens. And denial management is a nightmare for providers, right?
Yeah.
So much time and effort. How does automation tackle that beast?
This is arguably one of the most transformative areas. Future denial management flips from reactive to proactive. AI models will actually predict and prevent denials before they even happen, identifying likely issues based on patterns.
Wow. But when one slips through,
When a denial does occur, the system instantly categorizes it, why was it denied, and routes it to the right person or department automatically. No delays. But here's the game changer. AI will auto-generate the appeal letters.
seriously, write the whole appeal.
Yeah. Based on the specific denial code, it pulls all the relevant clinical notes, payer rules, medical necessity arguments, and crafts a customized, compelling appeal automatically.
That would save so much time and probably recover a lot more money.
It completely transforms denial management from this manual, frustrating slog to a proactive, automated, data-driven process. The potential to improve reimbursement rates is enormous.
Incredible. Okay, switching gears to the patient again. We talked about chatbots, but how does their experience evolve in this more automated future? Does billing become less awful for them?
That's definitely the aim. Patient engagement gets a major upgrade. Think automated, personalized reminders, clear, interactive statements that actually make sense, maybe even proactive notifications about their insurance benefits before a visit.
And the chatbots get smarter.
Much smarter. Handling a wider range of issues, maybe even reaching that predicted 80% of routine inquiries. But the really cool part is personalization. AI could analyze payment history and maybe other factors to suggest personalized payment plans that actually fit a patient's situation.
So not just one-size-fits-all demands.
Right. More empathetic, tailored financial solutions. And we'll likely see voice assistants dedicated to billing. Imagine just asking your smart speaker about your hospital bill and getting a clear answer.
Like Alexa for medical bills.
Okay.
That could be helpful. The overall impact sounds like much higher patient satisfaction.
Absolutely. Making billing clearer, easier, more empathetic. It removes a huge point of friction and stress for patients.
Definitely needed. Okay, last piece here. Compliance and fraud. Always critical in healthcare. How does automation bolster that?
This is compliance and auditing. Automation enforces the rules, billing codes, regulations in real time as things are happening. It reduces the chance of accidental mistakes that lead to penalties.
And fraud.
It becomes a powerful tool against fraud, waste, and abuse. By constantly monitoring billing patterns, AI can flag anomalies, weird spikes in certain procedures, unusual billing for specific patient groups much faster and more effectively than humans reviewing reports. It protects the financial integrity of the organization.
So individually, these are all powerful advances. Coding, claims, payments, denials, patient interaction, compliance. But you mentioned integration earlier. When you put it all together, what does that ecosystem look like? Is it more than just the sum of its parts?
That's exactly the point. When these are combined, seamlessly integrated, it's not just optimizing one step, it's redefining the entire revenue cycle, from the moment a patient schedules right through to the final zero balance.
A single intelligent flow.
Exactly. It creates this powerful interconnected system, and that delivers not just efficiency, but much better accuracy, solid compliance, and importantly, builds patient trust because the whole financial side becomes less confusing and adversarial. It's a holistic transformation.
Okay, so if all these automated pieces need to work together, what's the operating system, the thing that holds it all together? We're not just talking about separate tools anymore, right? We're talking about these new-gen AI-powered RCM platforms. What makes them the real game changer?
That's a great way to put it, the operating system. Because, yeah, the individual tools are powerful, but they need orchestration. These new generation AI-powered revenue cycle management RCM platforms are that orchestrator.
And they're different from older billing software, how?
Fundamentally different. Historically, you had separate systems, right? Billing might be here, coding over there, managing receivables somewhere else. Maybe they kind of talk to each other, maybe through manual steps. These new platforms unify all of that.
So billing, coding, AR, all in one integrated system.
Exactly. One single, cohesive, intelligent system. Think of it like a central nervous system managing the entire financial flow, from patient registration and checking their insurance eligibility, right through coding, claim submission, payment posting, denial appeals, everything.
One source of truth for all the financial data. That sounds like a dream for hospital administrators.
It really is. And because it's unified, it enables something incredibly powerful. Continuous learning. These platforms aren't just running on fixed rules. They use machine learning to watch everything. Every claim, every payment, every denial, every successful appeal.
And they learn from it.
Constantly. They spot patterns, figure out what works best, adapt over time. They get smarter with every transaction. So if a payer changes a rule subtly, the system learns and adjusts. If a certain approach to appeals works better, it learns that too. It's adaptive.
That's the AI really working, getting better automatically. And healthcare is so complex. Different insurers, different medical specialties. Can these platforms handle that diversity?
They have to. They're specifically designed to optimize workflows across multiple payers and different medical specialties. Think about it. Medicare rules are different from Blue Cross, which are different from Aetna, and cardiology billing is different from orthopedics. These platforms understand and manage that complexity, applying the right rules for the right situation automatically.
They basically learn the nuances that take human teams years to master.
In many ways, yes, and they apply it consistently, 2147.
And for the finance folks, the managers, the executives, what kind of visibility do they get? Is it faster than waiting for monthly reports?
Oh, absolutely. They provide real-time, deep visibility into everything. Denial rates, cash flow status, where every single claim is in the process right now.
Not just summaries, but granular data.
Yep. Unprecedented financial oversight. They can spot a negative trend emerging today, not next month. They see a potential issue with a specific payer starting to brew. It allows them to make informed, data-driven decisions immediately. Adjust a strategy, fix a workflow problem.
So it really shifts things from reactive firefighting to proactive strategic management.
That's the core change. These platforms aren't just automating tasks. They're enabling intelligent decision-making, adaptive processes, fundamentally changing how healthcare organizations manage their financial health. It's about gaining control, cutting the admin burden, and freeing up resources.
Which ultimately means more focus on patients.
Exactly. Freeing up money, and just as importantly, people's time and brain power to focus back on the core mission, patient care and medical progress.
So we've talked about the tech, the platforms. Let's boil it down. What does this all mean? Beyond the cool technology, what are the real tangible benefits for the hospitals and clinics, and maybe most importantly for you, the patient? This is where it really matters, right?
Absolutely. Let's unpack those benefits. The first, and maybe the most fundamental, is accuracy. We talked about manual errors in coding, in claim details. Those are costly. They cause rejections, delays, rework. Automation with AI and RPA checking everything, it drastically cuts those errors down.
Cleaner claims the first time.
Exactly. Machines don't have typos, they don't forget a modifier, they don't get tired. That improved accuracy is foundational.
And if claims are accurate first time, they get paid faster, which means speed.
Precisely. Automation accelerates the whole cycle. Claims get scrubbed and submitted in seconds, not hours or days. Payments get posted automatically. The result? A significantly faster reimbursement cycle. Providers get their cash flow much quicker.
Which is vital for keeping the lights on, investing in care.
Absolutely. Imagine getting paid days after service, not weeks or months. It changes the whole financial dynamic.
And faster, more accurate processes must save money, right? So cost savings, how does that work?
Big time. There are direct savings reducing the sheer number of people needed for repetitive data entry, claim follow-up, denial chasing. You can redirect those staff to more valuable patient-facing roles or simply reduce overhead.
And indirect savings.
Yeah, you save money by avoiding the costs of fixing errors, resubmitting claims, writing off bad debt from denials. It's fewer fires to put out, which costs money too. So direct labor savings plus savings from fewer screw-ups. It adds up fast.
Which leads right into denial reduction. That's always a massive headache for providers, isn't it?
Yeah.
Lost revenue, wasted effort.
Huge headache. And denial reduction is a major win here. Like we discussed, AI helps prevent denials before they happen by catching errors up front. And when they do happen, AI helps automate the appeal process effectively.
So fewer denials overall and better recovery on the ones that do occur.
Exactly. That translates directly to more revenue captured, more predictability in income. Even a few percentage points improvement here can mean millions for a larger provider.
Okay, and for the patient, we touched on better engagement, but how does that feel? What's the benefit for them? Better patient satisfaction?
Definitely. Think about it. Fewer confusing bills, fewer surprise charges weeks later, fewer frustrating phone calls trying to understand a statement. When the process is clear, transparent, easy to navigate, maybe through a good portal or chatbot, it reduces patient stress enormously.
They feel more informed, less like they're battling the system.
Right. It builds trust, makes the whole experience less adversarial. That's a huge win for patient satisfaction.
Absolutely. Yeah. Hey, and one more benefit you mentioned, predictive analytics. Having a crystal ball for finances, how does that help?
It's incredibly powerful. Using AI to analyze trends, These systems can forecast revenue much more accurately. They can spot potential problems early, like maybe denial rates are creeping up with a specific insurer, or cash flow might dip next quarter based on current patterns.
So it gives them an early warning.
Exactly. It allows providers to be proactive, adjust strategies, address issues before they become crises. It brings a level of financial foresight that was really hard to achieve before.
So putting it all together, accuracy, speed, cost savings, fewer denials, happier patients, better forecasting. It's not just tinkering around the edges, is it?
Not at all. It's a fundamental shift. The big idea is, by making the administrative engine run smoothly, intelligently, efficiently, you free up resources. Money, yes, but also people's time and focus.
So put back into actual healthcare.
That's the goal. Less time on paperwork, more time on patient care, research, innovation. That's the ultimate promise.
Okay, it sounds amazing, but it's never that easy, right? There have got to be hurdles. While the benefits are clear, what are the big challenges healthcare organizations face when they try to implement this kind of deep automation that feels like a massive undertaking?
Oh, you're absolutely right. It's definitely not a walk in the park. There are significant roadblocks. One of the biggest, and rightly so, is data privacy.
AP and all that.
Exactly. These systems are handling incredibly sensitive patient health information, PHI. You absolutely must comply with strict regulations like IP in the US, GDPR in Europe. The penalties for breaches are severe, huge fines, lawsuits, complete loss of patient trust.
So security has to be baked in from the start, not an add-on.
It has to be foundational. Robust cybersecurity encryption, strict access controls.
Yeah.
It adds complexity and cost, but it's non-negotiable.
And speaking of cost, that must be another big one, especially getting started.
For sure. The initial cost can be a major barrier. Setting up these advanced platforms, migrating mountains of old data, integrating them with existing systems, training staff, it's a substantial upfront investment.
Not just buying some software off the shelf.
No way. It often requires customization, maybe infrastructure upgrades. For smaller practices or hospitals with tight budgets, that initial capital outlay can be really tough, even if they see the long-term savings. It's a multi-year commitment.
A big leap of faith financially. And then there's the people side. You're changing how everyone works. That must lead to resistance to change.
Absolutely. That human factor is huge. Staff who've done things manually for years might worry about their jobs. Is this robot going to replace me? Even if jobs aren't cut, learning completely new workflows, trusting AI, it's a big adjustment.
So how do you overcome that? Just force it on them.
That rarely works well. It requires really good empathetic training. Not just click here, but explaining the why. Showing how automation frees them up from tedious tasks to do more interesting, valuable work. Honest communication about how roles might evolve, not just disappear, is critical for getting buy-in. It's a cultural shift as much as a technological one.
Makes sense. You need to bring people along. Okay, and then the tech itself. Healthcare IT is famous for being messy, right? Lots of different systems that don't talk to each other. Isn't integration a nightmare?
It's arguably one of the biggest technical headaches. You've got dozens of different electronic health record systems, EHRs, each with its own way of doing things, then clearinghouses, all the different insurance company portals.
Getting the new automation platform to connect smoothly with all of that existing stuff.
Exactly. It requires complex technical solutions, often custom integration work, to make sure data flows correctly and securely between all these different systems. You have to avoid creating new data silos while connecting the old ones. It's intricate work.
So tackling these challenges, privacy, cost, people, integration, it's not just about buying tech. It needs a real strategy.
Precisely. It needs careful planning, serious investment with a long-term view, and a major focus on managing the change for staff and getting the technical integration right. Overcoming these hurdles is key to actually getting those amazing benefits we talked about.
Okay, let's push even further out. Let's really look into the crystal ball. The source material had some fascinating predictions for, say, 2025 to 2030 and beyond. What's the really big picture? Where is this all ultimately heading? It feels like more than just optimizing what we do now.
Oh, it's definitely heading towards a fundamental reimagining. The grand vision, looking out towards the end of this decade, is truly end-to-end automation.
Meaning the entire journey, from start to finish.
Pretty much. Imagine a patient experience where almost all the administrative friction is gone. You book an appointment easily, online or voice. Your eligibility and authorization happen instantly behind the scenes. After your visit, coding, claim submission, payment, balancing. It all flows automatically. Minimal human touch needed for the routine admin stuff.
Wow. Seamless. And you mentioned AI writing appeals earlier. What about generative AI? Does that play a bigger role?
Huge role. We're moving beyond templates. Generative AI will draft incredibly complex, nuanced appeal letters, pulling in specific clinical evidence, citing policies, really sophisticated stuff. It will also craft personalized, empathetic responses to patient billing questions, not just canned answers.
And even find problems before they start.
Yeah, potentially. By synthesizing data from everywhere, it could proactively spot discrepancies or missing info in claim data and flag it, or even correct it before it causes an issue down the line. It's about intelligent content creation and proactive problem solving.
That's powerful. Okay, something different. Blockchain. We hear about it for crypto, but how does it fit into medical billing?
The potential is really interesting for blockchain integration. Imagine every step of the billing process: service delivered, code assigned, claim sent, payment received, appeal filed, recorded on a secure, unchangeable, shared ledger.
So everyone sees the same history.
Mm.
Patient, provider, payer.
Exactly. It creates transparency and trust. It could slash fraud, make audits way simpler, and reduce disputes because there's a single verifiable record that can't be tampered with, an undeniable audit trail.
That could solve a lot of arguments. And what about how we interact with these systems, especially with telehealth booming?
We're likely to see a big rise in voice-based coding and billing. Imagine a doctor finishing a telehealth call and just dictating the key info, maybe saying bill for moderate complexity follow-up, and the system understands, codes it, and cues the claim.
So coding happens right at the point of care, just by talking.
Potentially, yes. More intuitive, less clicking and typing, especially useful in remote or mobile care settings. It integrates billing more seamlessly into the clinical workflow.
And for patients asking questions, you mentioned chatbots handling maybe 80%.
That's the prediction. AI chatbots handling 80% of patient inquiries. That's a massive shift. Most routine questions, balances, payments, coverage checks get instant answers, 247.
Which frees up the humans for.
For the really complex stuff, the sensitive financial hardship discussions, the weird multi-payer coordination issues, the things that need genuine human judgment and empathy. It improves efficiency and allows for better human support where it's needed most.
Okay, this future sounds incredibly efficient, almost frictionless. Can you maybe walk us through an example? Paint a picture of what a typical patient journey might look like in this 2030 scenario.
Sure, let's try. Imagine you need a checkup. You use an app, or maybe just tell your home assistant, schedule a checkup with Dr. Smith.
Done. What happens next?
Instantly, behind the scenes, an AI checks your insurance, confirms eligibility, and gets any needed pre-authorization for the visit. You get a notification. Appointment confirmed, estimated copay is $25. No guesswork.
Wow, cost clarity up front. Love that. So, you have the visit.
Yep. Afterwards, as Dr. Smith finishes typing or dictating notes into the EHR, the AI analyzes those notes in real time and accurately assigns all the CPT and ICD-10 codes. No delay waiting for a coder.
Instantly coded. Then the claim.
The claim is auto-generated and submitted almost immediately. But first it goes through that intense AI scrubbing, checking against payer rules, compliance guidelines, everything ensuring it's clean.
A clean claim goes out lightning fast. Payment comes back.
Electronically, likely very quickly. The AI platform auto-posts the payment, matches it to the service, and instantly calculates your remaining balance to that $25 copay.
And I get notified how?
You get a smart statement on your phone or portal. Super clear, plain language. Insurance paid X, your copay is $25. Maybe a button to pay right there. You tap it, or tell your voice assistant, pay the $25 bill from Dr. Smith. Done.
Okay, but what if, just what if, something does get denied? It still could happen, right?
It could, though it would be much rarer. If it does, the system flags it instantly. The AI analyzes the denial code, pulls the relevant records, and auto-generates and submits a detailed appeal, often before a human billing specialist even sees the denial.
So the system fights the denial automatically.
In many routine cases, yes. The whole process, scheduling to zero balance, becomes proactive, transparent, and largely automated for standard encounters.
That really does sound like a different world. It flips the whole model from reactive and manual to proactive and automated. And the main goal the source material emphasizes is, what again?
The core idea driving all this. It's to free healthcare providers to focus more on providing care and less on this incredibly burdensome paperwork and administrative hassle. take that weight off their shoulders.
Let doctors be doctors, nurses be nurses.
Exactly. Let them dedicate their time, their skills, their resources to healing, to innovation, to actually caring for patients. It's about liberating the human potential within healthcare.
Well, there you have it. This deep dive, I think, really shows how automation in medical billing isn't just some background IT project. It's a fundamental overhaul. It's leading us to a future that's more intelligent, much faster, and actually, surprisingly, more patient-centric.
Yeah, moving from that manual reactive mess to something proactive, accurate, and automated. It's a quiet revolution, maybe, but the impact will be huge.
A future where, hopefully, efficiency meets empathy, where that admin burden finally gets lighter, allowing for more focus on actual care.
The potential it unlocks is really significant.
So thinking about all this, what stands out to you from our dive into billing automation? And here's a thought to chew on. If we really do lift this massive billing burden off healthcare providers, what new frontiers does that open up? What does focusing more on care truly unlock for the future of medicine itself? We'd love to hear what you think.